So our topic was auditory discrimination and articulation errors in a child with a cochlear implant. Our client is 12 years, 1 month with a sensorineural hearing impairment. Her hearing loss was congenital due to teratogens. She was implanted with a bilateral cochlear implant at the age of 3. Her speech and language diagnosis is articulation and auditory discrimination errors are present in voiceless fricatives, specifically high-frequency, low-intensity vocalizations such as S, F, and TH. So a cochlear implant is a device that provides direct electrical stimulation to the auditory nerve in the inner ear. Here's a short video of how a cochlear implant works.
How a cochlear implant works. Sounds are picked up by the sound processor, which sits behind the ear. These sounds are turned into digital code, which is then sent to the implant just under the skin. The implant converts the code into electrical signals and sends them down to the electrode array. The electrode array is fitted in the person's cochlea. When the signals get to the array, they stimulate the nerve fibres in the cochlea, and the signals are recognised by the brain as sound.
So what's expected in a hearing impairment diagnosis? There can be difficulties with intonation and prosody, multiple articulation errors which result in unintelligible speech, slow growth of MLU, limited comprehension, problems with morphology and syntax, and small vocabulary. What's expected in an articulation diagnosis for a child with a cochlear implant? During critical periods of speech development, the distortion of high frequency, 3,000 to 10,000 hertz, low intensity sounds may imprint an incorrect speech pattern in the brain that will be used for future speech reference. And here's a video of what speech sounds like with the cochlear implant. It goes through different channels of the cochlear implant. So that's the first channel.
What kind of bait do you use to catch sound?
You're so stupid.
What kind of bait do you use to catch sound? What kind of bait do you use to catch sound? What kind of bait do you use to catch salmon?
So you can see how the high frequency sounds can kind of get filtered out, and it also sounds so low.
Okay, and treatment for an individual with a cochlear implant should begin as soon after they're implanted, and therapy should begin with teaching to attend to sound and alert when sound is present, and then moves through discrimination of suprasegmental aspects of speech like prosody, and then move to discrimination of sounds and moving into audition to learn language. So first we decide to start with auditory discrimination because, like I said previously, discrimination of speech sounds is important. So the client would be presented with 2 modalities, a visual and auditory. So the auditory would be the SLP saying the initial sound to them, and the visual would be wave server. And the clinician would provide the client with spectral cues, which are the use of the spectrograms, to be used as visual aids for discriminating the targeted phonemes through the use of spectrograms. And it was found that spectral cues were important for English phoneme recognition in quiet-ended noise. And this is just an example of how the phoneme should look. So we would do the clinician would do what the sound should look, and then we would have the client record their sound and look at the differences to see which one is the proper way of saying the phoneme.
This is
Yeah, so this is I don't know if you guys have ever seen this True Life episode, but it's True Life on Deaf. We're just going to play a short little clip of a guy or a boy that was just recently implanted with a cochlear implant. Not sure exactly how old he is, but in this sentence, he is saying, "My name is Christopher." So just pay attention closely to those high frequency sounds, specifically S and is and Christopher, and just hear how it can get distorted.
In silence.
I'll play it again.
Yeah, this is
In silence.
Did everybody hear that? Like how the S is very distorted. And then when he says is, it would just completely like drop. He just says it. And then, I mean, I don't want to imitate him because I won't do it. Great. But that's, yeah, you can see how the high frequency sounds get distorted. So after, in correlation with auditory discrimination, we also work with his articulation, and we would use the traditional approach, which I don't know if anybody's familiar with the traditional approach, but it's a method to use in articulation therapy. And it basically will start with producing the sound in isolation, which is just the specific phonemes that you're working on. So we would work with S, F, and TH in isolation. And one of the procedures that we chose to work with our client with is maybe using the game Jenga. Someone else presented that before, using that game. And you just put the specific phoneme on the Jenga piece, and as you take turns going back and forth, and whoever pulls the piece, they have to, say there's an F on the Jenga piece, and he has to produce the F. And then the clinician can also model in turn two of the appropriate productions of the high-frequency sounds. So for the instrumentation that we chose to use with our client, we said wave surfer, like Lindsay said, to address perception of high-frequency sounds. Going back a little bit on what she said, the clinician will produce the appropriate production of the high-frequency sounds into wave surfer, and the client will analyze what it's supposed to look like, what the high-frequency sounds will look like, and maybe practice at home with their parents, comparing and contrasting the differences between the appropriate production and his production. And then also the electroglottograph, which measures electrowaves of vocal folds opening and closing. So with this program, with this instrument, the client, like in this picture, will speak into the microphone, and you will be given a visual illustration of what their productions are. And with the high frequency sounds specifically, the closing of the vocal folds will show the high frequency sounds of S, F, and TH that we're targeting because they're voiceless. And then we said we could work with their cognate. So for F, he could produce it with the V and show the opening of the vocal folds or the vibration. And also just another technique that can be used in articulation therapy specifically, or in therapy for this specific client. We could teach the client how the vocal fold vibration will be felt on the throat, and when there is no vocal fold vibration, no vibration will be felt. So as they're producing the high frequency sounds of F, S, and TH, they'll keep their hand on their throats to feel the vibration and not feel the vibration with the cognitive. So our student learning outcomes that we wanted you guys to know from this presentation is the students will be able to identify characteristics associated with children implanted in cochlear implants. The students will learn remediation techniques for high-frequency articulation errors, and the students will learn specific instrumentation to implement into therapy for children with cochlear implants. Did everybody get that out of this presentation?
Yes.
Okay,
Yes.
good. And then just quick questions. What frequency range do children with cochlear implants have difficulty with? Yeah, you get 3,000 hertz to 10,000 hertz. And what area of communication do children with cochlear implants display the most difficulties with? Yeah, all of the above. These two we talked about, but this we mentioned intonation and prosody. They will have trouble because they can't, hear the specific high frequency.